the elephant in the room. Men as change agents in the family planning discourse. Family planning, childbirth spacing. Call it whatever name. I remember growing up, I think I'll speak from 3 perspectives. I'll speak as the desk officer for family health. I'll speak as a woman, a mother, a wife. And I'll speak as a Nigerian. First, as the desk officer for family health in Nigeria, of course, I want all our families to be healthy. I want to see a Nigeria where everyone is smiling not because they are forced to smile, but their smiles are coming from the bottom of their hearts. They don't have to struggle with meeting the needs of their families. Thank God for that statement, that you bring up a family that you can manage. That you can manage, like my husband told me several years ago, that one of our very rich men in this country, I will not mention the name, if he had had just that one wife and just a sizable number of children, apart from the children enjoying the wealth of the family, there would have been a very healthy family, emotionally, spiritually, physically, and in all ramifications. But if I start to tell you what happened to that family, how that family ended up, you will know who I'm talking about. It actually did not end well. And the aftermath of unplanned family still follows the man as we speak today. So, still as the desk officer for family health, where does the man have to come in here in family planning? We've heard it that the men take decisions in the homes, in the families. Yes, there are some women that God has empowered to contribute to decision making, but in the long run, as a religious community that we have in this country, we still want to bow for the man when it comes to decision making. So we need to focus on them. And I really appreciate what my sister Diane said, educate them. Educate in what sense? You need to educate them on the benefits they stand to get from family planning. Yes, I said I would talk as a wife, as a mother, as a woman. Many years back, I had a maid. No, my houseboy, so to say. And then one day, his mom came visiting. I was now asking, how old are you? She told me her age. I'm talking of like 15, 20 years now. And she told me her age was like 10 years old, younger than I was. And I was like, no, you don't mean it. And she told me it's condition. I asked myself, what condition? Why would you? The boy was older than my own children that he was taking care of, actually. And if that woman had given birth to the number of children that she would be able to cater for with her husband, of course, the husband was nowhere to be found by the time she was spreading the children about town. And I asked her, what kind of condition? She said she couldn't, that she was suffering. I followed her home. It was something else. I couldn't imagine a human being like me living in that kind of home. Of course, I know what we had to rally around to do for her, apart from taking care of her son. So, as a mother, as a woman, if you think about your own health, and that's what's going to make me to prescribe for us, I know that it is the responsibility of government to make policies, but we can set agenda before the policy is made. We've heard of countries where they are much richer than us, but their population is much lower than us. Why not have the slogan, that's 80-20 rule, 80 years, 2 children? Why not promote that? You want to live up to 80. Life expectancy is now about 52, 53 years. Who does not want to live up to 80, 100 and still be healthy about doing what you love to do? So if we begin to look at that, encourage men, women to live up to 80 and even beyond, and tell them, if you want that kind of a thing, if you want to enjoy life, have fewer children. The health of the woman is of the essence. Because in childbearing, apart from the pregnancy period that puts a lot of stress on the woman, while nursing the baby, waking up in the night is something that puts stress on you. Feeding the baby is something that puts stress on you. God help you if you are a working mother. It's something else. And then I talk as a Nigerian. I want to see a Nigeria whereby we have the amenities working. Thank God I was around in the days of Electricity Corporation of Nigeria. Electricity Corporation of Nigeria. I don't know how many people know. Maybe the people that are older than me will remember. Before we had NEPA, there was nothing like up NEPA when, lights, suddenly you don't have light and then you have light and then the children will be jumping up. There was nothing like that. We didn't even know that there was any. I knew about ECN because our house was close to their office. We didn't know where the light was coming from. Just to press something on the wall and you have it. Can we go back to that era? But how? It is when we plan our families. I want to see that water is available, portable water is available. We are talking about social amenities. We are talking about infrastructure. Our infrastructure is overstretched. And it is because our population is expanding without us moving fast with the development of our infrastructure. I was just checking the internet yesterday, and I saw that just in 1988, yes, Nigeria's population was about 90 million. And the US, about 244 million. And South Africa, about 35 million. Today, just 30 years down the line, Nigeria's population has doubled and even crossed above double. US is just about 325, less than half. And South Africa, about 52. Look at the kind of investment they make even into their infrastructural development. Still, their population, they are not allowed to go haywire. The elephant in the room. What can the men do? We need to educate them on their own health. Some of them, they do what they do. We talk about corruption in this country. They do what they do because they want to make ends meet. We need to educate them. If you plan your family, you end poverty. I think that is my concluding statement. End poverty. You plan your family, you end poverty. Educate the men on what they stand to gain, benefits for their own health, for the health of their families, even for their environment, to live without miscreants on the road. How many of us like to travel by road now without having to have some special prayers before we set on the road? So we need to educate the men not just on the radio or on the television. And finally, when we talk about communication of family planning, it is everybody's job. All of us here, I want to see us as advocates, catalysts to the dissemination of family planning messages. I thank you for listening.
The way forward is for all stakeholders, which means all Nigerians, to join hands with the federal government to talk about family planning and to act on family planning. Yes, we really need our men to talk more about family planning. Yes, some of them might have been talking maybe from the professional perspective, but we need men that are actually the heads of families to begin to discuss with their wives, even pre-marriage. Discuss about the size of your family, the number of children you want to have, so that you can actually enjoy your life. Your life can be as long as you would love to have it, and be healthy. Yes, we have the National Family Planning Communication Plan, which has been approved by the National Council on Health, and it's on the website of the Federal Ministry of Health, which has given roles to everybody, individuals, organizations, governments, levels of governments. We all have roles and responsibilities towards the implementation of that plan. We have developed messages, stratified strategic messages, age-appropriate messages for everyone, and it is just for all of us to put our hands on deck and implement the plan. The effect of this plan is already visible. It's already visible. If you visit health facilities across FCT, for example, and in some other states, you will see the family planning logo, the new logo. which is different from the old one where you have the mother, the father, a child or something. But now you have the green dot, which was developed from the grassroots. The grassroots, the rural dwellers themselves, the stakeholders adopted the new logo, which is the green dot, and it tells you that family planning services are available in any facility that you see that logo.